We begin tonight with mental health in our children. New studies show severe mental health cases are becoming more common among youth. WNCT's Brandon Truitt joins us now with a look at kids in crisis. Brandon?
Angie, we often hear about mental health leading to self-harm and unfortunately suicide. But the cases I've discovered involving children are disturbing, and it's happening right here in the East.
A new study finds chronic health problems may play a role in suicide risk.
Suicide calls among children are on the rise.
Becoming a problem across the country as attempted suicide rates continue to rise.
Mental health. The stories heard time and time again, yet the topic often considered taboo. Statistics show an unforgiving rise in cases involving children ages 6 to 18. Is mental health, severe mental health, an issue for that age range here in the East?
Absolutely.
Janine Fox works with Integrated Family Services. The company serves patients throughout 25 counties in eastern North Carolina.
As of right now, for 2017, for that age range from 6 to 18, today we have served 184 individuals within Pitt County.
Doctors in Vidance ER say cases of severe depression and self-harm are so common, it's backlogging the department.
This company has started since 2003. The state basically looked to see, these are individuals were showing up to the emergency departments, and individuals were realizing, hey, we're having people show up that don't necessarily need to be here.
In 2016, Integrated Family Services had 625 calls in the East to help children at risk of self-harm.
Data shows that the trend is rising. We have served each year, the data keeps rising more and more. And those trends vary from various issues, whether that is depression, anxiety, self-harming behaviors.
According to the CDC, from 1999 to 2015, more than 1,300 children between the ages of 5 and 12 committed suicide nationwide. Yes, as young as 5. Although equally as tragic, most cases of mental health leading to self-harm are found between the ages of 11 and 15. That's around the time of middle school.
The adolescent suicidal ideation has been something that schools have always had to face.
Travis Lewis with Pitt County Schools.
Here lately, it's seemed to have taken on even more prominence.
Experts say part of the problem is social media posts containing embarrassing photos or information that can be shared dozens of times and often never goes away.
The person who says things that they wouldn't say or isn't socially acceptable to say to someone face to face, where they can say just the most awful things.
I talked with Travis Lewis of Pitt County Schools, who says that bullying is not maybe what I had experienced on the back of the bus. It's now over the internet. Yes. He suggested that might be number one.
And it is. From what we can see, that's the number one thing, the more pervasive thing that we see.
Aside from bullying, Fox says there are other factors playing a role, such as relationships, conflicts within the home like divorce, and sexual identity concerns. What is the first thing a parent should do if they feel like something might be off with their child?
Ask questions. Do not be afraid. That is your child.
There are other resources available. Take the Mobile Crisis Center.
Integrated Family Services Mobile Crisis, how may I help you?
It's a free 24/7, 365 service where help is just a phone call away.
There are trained qualified professionals, and the team consists of licensed clinical social workers, qualified mental health professionals, and so these people are actually going out and responding to these calls to say, here's how we can help.
Services are also available online, connecting you or your child instantly with professional help. Still, this crisis runs deep. From your point of view, what is the most disturbing part about this crisis?
How pervasive it is, and how it is consistently going on throughout the nation, and how children consistently do it, and how it is becoming more cruel.
Fox says that communication will be the key to getting a hold of this crisis. She says if you think your child might be at risk, to take advantage of those free resources. Of course, Angie, we've put those information on our website, WNCT.com.
Now, Brandon, what role do schools say they have in solving this?
Well, I talked to the mental health professionals as well as school officials who say now more than ever that relationship between a parent and the school is more important. Angie?
Absolutely. Thank you so much for that special report, Brandon.